Righty. So, welcome everyone to this exciting and new podcast. This is the second episode of the Journal of Clinical Anesthesia monthly podcast, where we feature noteworthy articles from each issue. I'm student Dr. Ashley Moore, assistant social media editor for the Journal, and your host for today's interview. I would like to offer a really warm welcome to Dr. Maziar Nourian, the lead author of an article from our June issue titled Perioperative Implications of Patients with AlphaGal Allergies. Thank you so much for taking the time to talk with me today.
Yeah, thanks, Ashley. Thanks for having me.
Great. So this leads me to my first question. As an anesthesiologist in the Department of Anesthesia at Vanderbilt University Medical Center, what prompted you to explore the perioperative implications of patients with alpha-gal allergies?
All right. Well, thanks for the question. And thanks again for having me. I think AlphaGal is important. It was something I didn't know about as a resident. It all started when I had a neurosurgical patient who had an alpha-gal allergy, and we were having quite a bit of intraoperative bleeding, but we were kind of limited in the space of what sort of anti-hemostatic agents we could use because those hemostatic agents could have triggered the alpha-gal allergy because they have a animal protein in them that actually is how they work. And so that kind of led me to figure out, like, are there other medications that I should not be giving this patient? And kind of coming up with different strategies. And so once we finished that case, weirdly enough, I had a string of 3 or 4 more patients who all had alpha-gal allergy. And that's important because we were in Tennessee, which is an endemic area for alpha-gal allergy. And then slowly I kind of became like the local, like pseudo expert on alpha-gal because I kind of collected all this information, talked with our pharmacy colleagues. And so anytime anyone was taking care of an alpha-gal patient, they would come to me to talk things through, and we didn't necessarily have a formal protocol. And so that kind of led me to see if I can do a little bit more literature review and come up with a multidisciplinary protocol for patients with alpha-gal allergy at Vanderbilt.
Okay. Thank you, Dr. Nourian. And can you briefly explain what alpha-gal syndrome is and how it relates to the mammalian products? Can you also give our audience more information about the term mammalian products and its significance in the operating room?
Yeah, absolutely. I know it sounds kind of kind of a crazy foreign thing. So alpha-gal, or sometimes it goes by the other name of like red meat allergy or mammalian product or mammalian protein allergy. Um, what it is alpha-gal is the carbohydrate. If you remember way back to biology, the galactose alpha-3, or short form alpha-gal, is that molecule that's present on tissues of cells. And so what happens is that patients become sensitized to these, and these are these proteins that are found on non-primate mammals. And then they're in the saliva of ticks, and I'll kind of explain why that's important in the future. But what happens is people become sensitized to alpha-gal or red meat. And so when they have subsequent exposures to this, they're having further and further allergic responses, immune responses. And so the reason I bring that up is mammalian products. And what that could mean is something as simple as like red meat or something that someone would eat and ingest and have an allergy to or issues to. But why that's important in the perioperative space is that, this goes into things like gelatins, which, could be capsules, things like capsules that could be used for pain medicines that a patient is taking after a surgery, all the way to bovine products, things that could be used in surgical procedures as like patches or artificial valves that have some aspects of bovine or pig technology that's in there. Heparin, which is used quite a bit in a lot of cardiovascular procedures. And then, as I mentioned in that neurosurgical patient, hemostatic agents like thrombin agents or whatever that were derived from these animal proteins. And so why that's important is, and I mentioned that, the Tennessee is a thing that we should, in the Southeast of the United States, is something we should think about, is that areas that are endemic to the Lone Star tick, as I mentioned, that this is in the saliva of the tick. As there are more and more tick bites, we're starting to see more and more AlphaGal allergies, like specifically in the Southeast United States. And so we're starting to see more and more of our patients come into the perioperative space who's saying like, hey doc, like I have this kind of weird allergy, like I'm sensitive to certain medications and some certain types of meats and everything like that, which kind of prompts further investigation. Of note, like AlphaGal has also globally been reported. So it's not just in the Southeast United States, but there are reports all across the world of people who have AlphaGal allergy.
Perfect. Thank you so much for answering that. Um, I know reading your article, this allergy is more so like a delayed type 4 hypersensitivity allergy. Do you mind diving in a little deeper and explaining how alpha-gal syndrome differs from other allergies in terms of its manifestation and triggers?
Yeah, I think this is something that a lot of the scientists and researchers in the allergy immunology space are really trying to better understand because um, alpha-gal is not a very straightforward allergy. It is actually somewhat confusing in the sense that you're going to get delayed symptoms has been the most commonly reported way of people describing. And so that could be something as simple as eating dinner, something that was, a heavy meat product, and then waking up in the middle of the night with GI upset or something as, even worse as like GI bleeding. However, there have been reported cases of anaphylaxis as well with exposure to these mammalian products. And so the wide range of these symptoms is something that sometimes is confusing. However, there seems to be a trend that further and further exposure kind of takes you down the disease, uh, the seriousness of the presentation of the disease, all the way up to anaphylaxis. Why this is also further confusing is some patients may show an immune response to the alpha-gal protein. They mount antibodies to this, but may not have symptoms to actual alpha-gal. And so, people can, be silent. Patients who suffer from alpha-gal syndrome and then could have a reaction in, the perioperative setting or in the post-op setting um, as a result of this disease. And so there's a lot of further work in allergy immunology world where they're trying to better understand the immune mechanisms of this whole disease.
Gotcha. Okay, understandable. And as a visual person, I would like to try to paint a picture just for our audience as well. So let's picture, I don't know, a medical student who is an aspiring anesthesiologist resident. She's doing a sub AI elective in the SICU, and she has a discussion with the attending anesthesiologist about alpha gal syndrome. What are some initial signs and symptoms this future resident should know about in terms of patients with this syndrome?
Yeah, I think that's a really good question. I think that it's good that even at the medical school level that people are starting to understand this allergy because it's now listed as the 10th most common food allergy in the United States with a lot more new cases being discovered in the past 10 years or so. So it's worthwhile starting, to educate people early on this. And so what I would tell this medical student is to do a focus history and physical exam for this patient. The history specifically looking at this patient of do they have a string of allergies that aren't necessarily related? This may be a patient who has, I don't know, 4 to 6 allergies listed on their allergy list that don't really follow the same class of medicines, but may have an inactive ingredient like gelatin that is triggering this patient to have symptoms. And why that's important is that while it may be the same drug, let's just say like Tylenol or acetaminophen, the generic name, one manufacturer of Tylenol may have an inactive ingredient that could trigger an alpha-gal patient symptoms, whereas another manufacturer may not. And so what I would tell this medical student is that is this patient having a constellation of symptoms that could be something like a rash or GI upset around a certain type of inactive ingredient? Do their allergies kind of have some sort of common theme? Have they had any recent tick bites? Have they been outdoors? These would all kind of like raise the triggers for, hey, you know what? maybe this patient has AlphaGal, maybe it's worth just, having some sort of allergy immunology consult for this patient, especially if they're inpatient, or have them see an allergy immunologist in the outpatient setting.
Gotcha. Okay. So I know also your article explains how mammalian products can be found in a number of medications, even common surgical products. You also mentioned in your article different strategies for cardiovascular procedures because this is just so renowned and important to know about. Can you please tell us in terms of like key perioperative considerations for patients with alpha-Gal syndrome? What are some things that anesthesiologists and physicians should really, really key down and know about in terms of the alpha-Gal syndrome?
Yeah, absolutely. So I think first and foremost, as we mentioned, is just educating everybody in the perioperative space about alpha-Gal. And just by starting, because it's something that not very many people know about. And, recent studies have shown that many physicians don't even know about this. And so it first just starts just by being the leader on your team to just help educate the whole team, scrub techs, nurses, pharmacists, getting everybody on board to educating as many people as possible. The next, and I would say mainstay protection against alpha-Gal syndrome is just prevention. And so that would be my first and foremost perioperative strategy, is to, discuss this with the patient about preventing any sort of further exposure to mammalian products that could trigger this patient's alpha-Gal syndrome. And so that comes from, after taking a detailed history and physical exam with the patient, if the case is not urgent, have them see an allergist beforehand to see if they need to do further testing to delineate their alpha-Gal syndrome, to decide if we want to do any sort of like allergy challenges to see if they need, they can be sensitized to the medication. But once the patient enters the perioperative space, deciding with your surgical colleagues and your pharmacy colleagues about kind of creating what we did was like an alpha-Gal kit, something where it's like we have pre-screened all these medications or these products that we're going to use for this type of surgery. So someone doesn't necessarily have to think about this. These are all screened to be okay. And that involves just the operating room and in the post-operative setting. Like, for example, we are not going to give a gelatin capsule to this patient in the form of Tylenol or oxycodone for pain afterwards, because it could trigger their alpha-Gal syndrome. And so the nice thing about having this kit also kind of comes with further strategies for communication. So kind of like if a patient has a latex allergy, multiple signs, multiple ways of communicating to other people, especially if people are coming in and out for breaks. Hey, this patient cannot receive these certain products for these reasons. In the cardiovascular world, our paper kind of discusses a strategy and kind of a protocol for dealing with a patient who potentially could have a reaction to heparin, which is a zyme from pig products, and which would potentially could trigger a patient with alpha-Gal syndrome. And so it's using alternative methods to make a patient's blood in a setting where it could go on to cardiopulmonary bypass, similar to what heparin could do. So there are alternative strategies for doing that. There's also potentially, if it's not an urgent case, a way to sensitize a patient to heparin beforehand. And then lastly, I'd say the next most important thing that an anesthesiologist needs to know is, how do you actually address or treat someone who is showing signs and symptoms of anaphylaxis? So any anesthesia provider should be comfortable and familiar with detecting anaphylaxis and being able to treat them and provide supportive care. Because as of right now, there really isn't a cure to alpha-Gal syndrome. So really, we're just focusing on prevention and supportive care if a patient is starting to show severe symptoms.
Understandable. Thank you for answering that. And lastly, How does the global medical community address the challenges posed by alpha-gal syndrome on a broader scale? And are there any type of ongoing research efforts to better understand this syndrome and improve the management?
Yeah. I think, as mentioned earlier, this is a disease that is not unique to the United States. There are reported cases all over the world, and that, as we talked about, may be present with or without tick bites. And so, I think first and foremost is just helping, raise awareness in the global community. Um, Talking about specific ongoing research, the hottest research in the AlphaGal world comes from the allergy immunology world, where they're really trying to figure out the immune pathways and elucidate those for a patient with alpha-gal syndrome, ideally. And there's talks about making a vaccine for alpha-gal syndrome, and so that's something that's further down the pipeline. And then they've also looking at other ways of diagnosing alpha-gal, so moving away from skin prick tests or oral food challenges, and maybe replacing them with like a mast cell activation test or a histamine release assay. But bringing this back to the perioperative world, I believe, as an anesthesiologist who's responsible for the perioperative home, one of the leaders in the perioperative home, you need to take the initiative to not only educate your colleagues, but talk to them about the potential impact of patients with alpha-gal syndrome, and really lead the multidisciplinary team in order to come up with protocols intraoperatively and postoperatively, in order to best take care of patients with alpha-gal syndrome.
I definitely agree. So again, thank you so much. Your research has definitely influenced me and the precautions I will consider as a future physician. Your research has also brought awareness to a very important subject, and I am sure you have influenced many anesthesiologists worldwide who reads your article as well. Thank you for taking the time to talk with me and allowing our audience to have a deeper and clearer understanding of the perioperative implications of patients with alpha-gal allergies. To all the viewers and listeners, please be sure to read the article in the Journal of Clinical Anesthesia June issue. And also be sure to follow our social media sites on X, formerly known as Twitter, Instagram, and Facebook at the Journal of Clinical Anesthesia. Again, thank you so much, and I wish you all the best.
Thank you so much, Ashley. Thanks for taking time.
Thank you.